We covered Justin Bieber's hair loss in a video last year. Someone recently Instagram messaged us to reevaluate Justin Bieber's hair, so here we are. And what we uncovered will surprise you. We previously mentioned that Justin first started to show signs of androgenic alopecia in 2017. I'm seeing the first signs of frontotemporal hair loss, and this appears to me to be an androgenic alopecia type of situation. By 2018, he already appeared to be a Norwood 2. And in 2021, he had dreadlocks, and we discussed how traction alopecia can sometimes result from tighter hairstyles. And once the dreadlocks came off, it appeared that he may have been using concealer in the corners of his hairline. But there were no signs of a hair transplant back then. But in 2022, Justin wore hats throughout most of the year. Did he have something to hide? It looks like he started to adopt two different techniques for covering the corners. The first was to use frontal scalp hair to comb over the corners of his hairline. And the second was to camouflage, such as with the use of topic fibers. Both of these methods may have been used to hide the appearance of some work that may have been done in that region. My best guess is that towards the end of 2021 or early 2022, Justin may have had a hair transplant to the frontotemporal areas. My guess is that this was an FUE procedure, follicular unit extraction, which is a 1-by-1 harvest from the back of the scalp. The scars can be hidden quite well after an FUE procedure. He may have had a procedure of about 1,000 to 1,400 grafts. There's also the possibility that the harvest was done with a no-shave technique, where individual grafts are taken just by cutting the hairs that you plan on transferring and not doing a full shave of the back of the scalp. We have a video that discusses the different ways that hair can be harvested from the back of the scalp. By February of 2023, his hairline is looking less recessed, but the density is not quite like his original hair, and that's very normal when it comes to a hair transplant surgery. Additional procedures can be done to increase density. This is not a failure of the hair transplant. This is something that occurs when you work into more bare areas, because surgical density is not the same as the original density. Oftentimes, building up the hairline with smaller procedures makes it less noticeable as you're getting this type of work done, especially in the case of Justin, who doesn't clearly want it to be very obvious. And also, it's a safer way to perform the hair transplant procedures because you don't want to over-harvest the back of the scalp, and you also don't want to overpack a recipient area and risk things like necrosis and hair just not surviving. Of course, we cannot say for certain if Justin Bieber had a hair transplant, but if this is the result of a hair transplant, I think it looks quite natural, and this is work well done. Remember that when it comes to hair restoration, hair transplant surgery is not the only option, so make sure to subscribe to this channel and watch our other videos to learn more about all of the options that exist.